In this video, we're going to address the male reproductive anatomy. And the male reproductive anatomy does, of course, differ from the female. And of course, like the female, we have to start at the outside. We have to start at what you can see. So I'm going to point a couple of these things out to you. This guy here, this is the scrotum, which is tissue that surrounds and supports the testicles. The scrotum, because sperm actually prefer a lower temperature than body temperature, will hang lower if the man's body is at a high temp, or it'll get closer to the body when the body is cold to try to keep those sperm at that ideal temperature. And that's actually a function of some muscles in the spermatic cord, or attached to the spermatic cord. Here, what you see is the foreskin. The foreskin is a piece of skin that's going to cover the head of the penis, and it's only prevalent, it is often removed as a result of cultural and religious beliefs. In my era and before, it was a good 80% of males were circumcised, removing this foreskin. However, nowadays that number is dropping down to about 50%. So this would be a male with the foreskin, and then what we can do is we can actually remove that foreskin, and I can show you that view in a little bit. This part of the penis here would be called the shaft of the penis, and we'll look at the internal anatomy of that shaft. If we were to rotate this guy around, it shouldn't be surprising that out this hole in the foreskin behind that, on the glands or head of the penis, there's going to be a urethral opening, so urine is going to come out here. When we remove the skin and a lot of the muscle, what we see is that there's fascia that's actually covering the penis. And there's several layers of it. The one that we actually talked about in class was this tunica albuginea, and this actually holds the corpus, or covers the corpus cavernosum. What I want you to see here is that there's fascia surrounding the testicle, and we also want to look at, what we want to see here is when we look at those testicles, and now the skin has been removed, you see all of these nerves here. And these nerves are kind of protecting this area, and they are basically why this area is so very sensitive. When we look at the penis, and here that foreskin's been removed, so this would look like the head of a circumcised penis. The foreskin would actually be, or prepuce, would actually be attached here, and then it would flap over. Looking at the structure, you're going to see there are a lot of vessels. That's because in order for the penis, well, one, the tissue does need some nourishment, but for the penis to get erect, we do need a certain amount of blood flow. When we get rid of the notations, we can hide some of these layers of fascia. The only fascia that we really went over was this tunica albuginea, and this one holds together the corpus cavernosum, or it covers the corpus cavernosum of the penis. When we remove a lot of the tissue, this is what we start to see. So remember that coming out of the penis, we've got two things. We've got reproductive fluids and we've got urine. So the penis is going to be connected to both so that it can conduct both of those fluids. We talked before about urinary. Now I really want to focus on sort of what is the pathway of sperm. So sperm are going to be made in the testicles down here, and then they're going to be stored, they're going to be made in the testicles down here, And then they're going to be stored in this structure. This is the epididymis. And once the male is involved in intercourse, what's going to happen is those sperm are going to travel down this vas deferens. The vas deferens it's a very long tube that the sperm are going to go down, but this is also the tube that is cut during a vasectomy to keep the sperm from getting to the penis, right? Because that would be an effective form of birth control. As we spin our model, we see that here you've got seminal vesicles. These seminal vesicles are involved in creating one of the components of sperm. So the testicles are creating the actual sperm, and then the seminal vesicles are involved in secreting what are called prostaglandins, which are basically, we talked about them as sperm road snacks, but they're things that the sperm cells can eat as they're in the reproductive tract for a few days. All right, so we've got to zoom in for this one, but if we zoom in down here below the prostate, we see this bulbourethral gland. And the bulbourethral gland, that is a really hard word to say, is involved in creating a lubricant. And if you think about where it is, it's located very near that urethra. And so it's going to lubricate the urethra so that the sperm have an easier time getting out. Between the seminal vesicle and the vas deferens, we've got this structure here. This is called the prostate. And we can actually, because it's visible body, we can look at this prostate. And what I want you to see is that the seminal vesicle and the vas deferens, so the sperm and then their road snacks, are going to come together. And those are going to be conducted through this tube here, which is called the ejaculatory duct. So when a male is involved in intercourse, what's going to happen is both of these glands are going to go, they're going to squeeze that stuff out, and then those bulbourethral glands are also going to conduct some mucus, and now the stuff coming out the urethra is going to be ejaculatory, or it's going to be semen. If we look at the shaft of the penis, we can actually separate it into several structures. I'm going to actually get rid of some of my labels here so that it's a little bit clearer. The head of the penis is also known as the glans. And the penis is made up of three very vascular pieces of tissue. The corpus cavernosum, these are the two on the top. There's a left and a right, and those are the ones that are covered by that tunica albuginea. And when we look underneath, this is the corpus spongiosum, and the corpus spongiosum is also going to be that spongy erectile tissue. What happens when a man gets an erection is that the arteries dilate, and when the arteries dilate, they let more blood into the penis, and at the same time, the veins constrict. So they're constricting the flow of blood out of the penis. And by doing that, they're actually helping the maintenance of that erection. If you think about drugs that are used to cause erections, they're usually very potent vasodilators. So they're used to dilate arteries a little bit more, so that you can get more blood to the penis. Remember that when we studied urinary, we looked at the urethra, and you can separate that urethra into prostatic, which is the part that runs through the prostate, membranous, which is that little part around the external urethral orifice, and then there's the spongy, which goes through the spongy tissue, or the corpus spongiosum and the corpus cavernosum. And that takes all of the material through the external urethral opening, which is this hole in the tip of the penis. We did discuss how, depending developmentally what happens, sometimes, we did discuss how developmentally sometimes that external urethral opening may not be in the right place, and that's a pathology called a hypospadias. Depending how bad it is, a doctor may actually choose to fix it. And so basically, as it's closer to the tip of the penis, it's a little bit more optional. But as it gets back towards the testicles, then that's going to cause some problems for that man, both reproductively, because it's hard to get semen into someone if your urethral opening is very far back. And it's also going to be a difficulty for them urinating, because it's going to be hard for them to not pee on themselves. So that's when it starts to become a pathology that needs a fix. What I'd like to do is talk a little bit more about the anatomy of the testicle. The testicle is actually going to be covered with a layer of fascia, and that layer of fascia is called the tunica vaginalis. And that tunica vaginalis is basically going to kind of hold that epididymis onto the testicle. When we look at the testicle in cross-section, what you're going to see is that the testicle itself is made up of these lobules. And these lobules they're filled with these spaghetti-looking tubes. And these tubes are called seminiferous tubules. And what they're going to do is they're going to be the site of the creation of sperm. And basically, as the sperm are migrating from the germ cell creation site toward the epididymis, they're going to be maturing more and more. Remember that this process is supported by hormones. You've got your follicle stimulating hormone, which is going to increase sperm production, and your luteinizing hormone, which is going to keep the testosterone within the testicle itself. In addition to germ cells within this region, you also have cells that are called nurse cells. And the nurse cells are involved in sort of supporting the germ cells. They're there to kind of help the sperm develop, and they're also cells that do secrete some nutrients and hormones and things.